In this section, I'm going to show you several supplemental tests to determine if your client has Piriformis syndrome. This is fairly common, and Piriformis syndrome rarely exists in isolation. They would register some pelvic misalignments. They would have positive tests, but you want to make sure that Piriformis syndrome is not coming, that it's coming from the piriformis and not coming from a herniated disc or any structure like that. So there's a couple of ways that we can determine that. So for this test, the patient is lying supine, and let's say she's having her symptoms on this right leg. So I want to make sure, test the opposite leg, and I'm going to raise it up just like that. And if that reproduced any symptoms that she's having, that would be an indication to me that the pain is more coming from the low back, possibly a disc issue, herniation, something like that. And in my case, I would refer out. But if it doesn't, then I'm going to move on to the affected side to eliminate possibility of disc problems at L4, L5, or even higher up. I'll lift up her leg to about 45 degrees and I'll ask her, does this reproduce any of your pain?
No.
Okay, Janet, would you pull your toes back? How about that?
No.
All right, so if that did, that would be an indication that the pain is coming possibly from L4, L5 discs. So now I'm going to externally rotate. I increase the flexion, externally rotate, and I'll ask her if that makes her symptoms any better.
Yes.
So I put it on slack. I put the piriformis on slack by externally rotating it. And now, so that made it better, which is consistent. Now, if I internally rotate, that's putting it on a slight stretch. Does that make it a little worse?
Yes.
Okay, so that is all very much in line with her good indications that there is a piriformis issue with the piriformis. All right, so a couple more tests to determine if there is piriformis syndrome going on, because you want to take it. There's a fair number of tests that you can do. In fact, this is called the FAIR test, and I'm going to be doing more internal rotation from a side lying position just to add that little bit more of certainty here. So what we're going to do is increase the internal rotation, which puts the piriformis on a stretch and should reproduce the symptoms. So that's what I'll do right now. It's quite simple. We're going to go into a little flexion. Just let me have your weight. Little flexion and more internal rotation. And does that increase your symptoms?
Yes.
Okay, so we have a positive for that FAIR test. And now the next test is called the Peggy test, which will be a resisted external rotation with a little abduction. I'm going to move to the back of the table to do that. And I'm going to instruct her to separate her legs like that, so we have a little rehearsal. And now I'm going to resist that movement, which is going to require more fibers to fire off. So go ahead, fair amount of resistance here. And does that reproduce any of your symptoms? Yes, so that's a positive for a Peggy test. So she's batting 1,000 right now. We have 2 more tests that we're going to do that will solidify this indication of piriformis syndrome. There's 2 more tests that I like to use to determine if there is piriformis syndrome going on. I like to use the PACE test and the Freiberg test. So one is resisted abduction, one is resisted adduction. Okay, so this first one is a PACE test. All I'm going to ask the client to do is push, and does that reproduce your symptoms?
Yes.
And the next one, the Freiberg, is resisted adduction. Go ahead and push.
Yes.
Okay, so those are some more tests that you can use to determine if piriformis syndrome is present with this client.